Hello, I'm Dr. Howard McCollister, one of the minimally invasive surgeons at Riverwood Healthcare Center in Aiken, Minnesota. Welcome to this informational seminar on hernia. MIMUS is a division of the surgery department at Riverwood Healthcare Center. It's dedicated to the concept of performing surgery using minimally invasive techniques. We found that the smaller incisions and the more precise surgery makes for less pain, fewer complications, and a quicker return to normal activities. My partners and I have spent many decades learning and perfecting and teaching these operations. We should start by answering the question, what is a hernia? A hernia occurs when the tissue, usually internal organs and usually a loop of intestine, bulges through a tear or an opening in the abdominal wall. That's in the case of a ventral or an incisional hernia, or in the groin area in the case of an inguinal hernia. These are the two most common types of hernias that we see. In some cases, these hernias are present at birth. In others, they can develop and enlarge over time. Other types of hernias can occur at the site of an old incision. As you can see, hernias of one kind or another are very common. As surgeons, it's one of the most common surgical problems that we see. Risk factors of developing a hernia include older age, a family history of hernia, previous abdominal wall injury such as a previous operation, smoking because it impairs the strength of the tissues, and ongoing abdominal straining such as with chronic coughing or chronic constipation. How would you know if you had a hernia? Symptoms might include a noticeable bulge in the groin or in the belly button or somewhere else in the abdominal wall, oftentimes with pain or discomfort. Ultimately, it may take a visit to your doctor to make the diagnosis, but in some cases, it may be hard for either for him or her to make that diagnosis, and they may have to recommend radiographic studies such as an ultrasound or a CT scan. The most dramatic risk of a hernia is incarceration and possible strangulation of the loop of intestine that has herniated and is protruding through that hole in the muscle wall. That's a pretty dramatic event, and it hurts a lot. It usually requires emergency surgery, but it's a relatively rare complication. It's not something we see very often. Nevertheless, it is something that patients need to be aware of. More notably, hernias will never go away, and over time, they will only get bigger. The only way to cure a hernia is with an operation. There's no exercises, no other measures that you can take to make the hernia go away. Usually, it's not urgent to fix a hernia of any kind. Watchful waiting is a viable option in many cases if that's the patient's preference. When we look at the statistics, the most common reason people come to us wanting their hernia fixed is because of increasing pain, usually followed by the fact that the hernia is getting significantly larger. It's very common for hernias to become more painful as they enlarge over time. Nevertheless, the risk of a hernia is usually, but not always, pretty low. If the patient can stand the pain, the timing of the hernia repair is pretty much optional. There are several other reasons why a hernia might be repaired, as listed here, but the most common one is pain. Your doctor or the MIMUS hernia surgeon that you can see can advise you on the urgency of surgery. We do need to talk about mesh in hernia repairs because the vast majority of hernia operations do require the use of mesh, and because it's a topic that certainly has the attention of personal injury attorneys around the country. So, to the question, is hernia repair safe? The short answer is yes. The problem, and the reason we have to use mesh to repair hernias, is that hernias are a disease of weak or damaged connective tissue. Simply tightening that same weak tissue leads to the hernia coming back in a high percentage of cases. The use of the right kind of mesh drastically reduces the chances of recurrence of that hernia. Most of the complications and injury from the use of mesh came from its use by gynecologists using some types of mesh for urogynecologic operations in bladder or urethra surgery in women with bladder leakage problems. The risk of using the most modern meshes, which is what we use here at MIMUS, is extremely low. Mesh complications using the woven polyester meshes that we use are extremely rare. As I mentioned, watchful waiting is a viable option. The risk is low, and if the patient can tolerate the pain of that hernia, that observation process is a valid choice. At MIMUS, we really try to avoid open hernia operation. In rare cases, that's necessary, but it's a throwback to the old days of surgery, and we found it usually to be unnecessary as a means of fixing a hernia. We usually prefer a minimally invasive repair because it has less pain and quicker recovery. And in the realm of laparoscopic minimally invasive surgery, we vastly prefer to use the Da Vinci surgical robot to repair hernias. The benefits of robotic-assisted laparoscopic repair of a hernia, well, it's minimally invasive. It provides us with a three-dimensional, 10-powered magnified view. It demonstrates improved ergonomics and dexterity for the surgeon. We're able to close the anterior abdominal wall defect, which is something we can't do laparoscopically. And there's less operative trauma, less pain, therefore less pain medication, and back to your normal life sooner. Can there be complications from hernia surgery? Any operation can be associated with complications, but they're very rare, and with minimally invasive hernia surgery, even less so. The immediate complications might be a bladder injury during the operation. There might be urinary retention after the operation, particularly men might have difficulty urinating. There can be cardiovascular events, as there can be with any operation. And just as with any operation, there can also be bleeding or infection problems. But those are relatively rare complications, occurring somewhere between 1% and 2% of the time. The long-term complications are not very common as well. Sometimes we will see persistent groin pain because of local nerve irritation, and sometimes in a small percentage of cases there can be recurrence of the hernia. We have found that hernia recurrences using robotic techniques are lower. You and your surgeon will decide on which technique is the most appropriate for your repair. For most repairs, general anesthesia is required. Once you're asleep, the surgeon will insert a small camera, allowing them to see the hernia from the inside. Other small incisions are then placed to allow access for other instruments, which the surgeon uses to remove any abdominal contents from the hernia and close it. In most cases, a mesh is then placed to prevent recurrence. The surgeon then removes the instruments, closes the small incisions with absorbable sutures and usually a surgical glue. I want to emphasize that the robot is only there to accurately translate the surgeon's actions. We don't just hook you up to the robot and go have a cup of coffee. It can't make a move without us. It does allow better and more accurate visualization, more dexterity as well. In many operations, that capability isn't absolutely necessary, but in this operation, the added precision makes for a better recovery in our experience. This is the view that we get at the robot console, except that we see it in 3 dimensions. It allows us to create a great space for the mesh with less chance of damage to important surrounding structures. It allows us to accurately place the mesh and then accurately sew up the incision in the peritoneal lining. Immediately after the operation, you'll be transported to the recovery area where you'll be monitored for 1 to 2 hours. Most patients go home on the day of surgery. This is usually outpatient surgery. For more complex procedures, you may need to stay overnight in the hospital. It's normal to be sore afterwards. This can usually be controlled with Tylenol or ibuprofen, or sometimes both, but sometimes stronger pain medication is necessary, and those will be prescribed prior to your discharge. You're encouraged to be up and about the day of surgery and to slowly resume your normal activities. We may apply some lifting limitations for a period of time, usually not more than 4 to 6 weeks. And you will follow up with your surgeon in 1 to 2 weeks after surgery so they can check the incisions and make sure that your healing is taking place as we would expect. This, of course, is the age of COVID. And so it's reasonable to ask the question as to whether or not it's safe to actually have surgery or even come anywhere near a hospital. Riverwood Healthcare Center goes to extraordinary lengths to keep our patients safe, especially during this pandemic. The surgical staff are screened on a daily basis. The surgical suite is completely isolated from the rest of the hospital. Floor nurses and potential COVID positive patients never come in contact with outpatient surgical patients or staff. And Riverwood completely adheres to the best practices advised by the Centers for Disease Control and the State of Minnesota Department of Health. Why would you choose the Minnesota Institute for Minimally Invasive Surgery at Riverwood Healthcare Center for your operation? Simply because MIMUS and all 5 MIMUS surgeons have been leaders in minimally invasive surgery in the upper 5-state region for almost 25 years. We have the staff, the tools, and the skills to give our patients the very latest in modern surgical technique. If you have questions or if you want to schedule an appointment for consultation with one of our hernia specialists, you can call the Riverwood Healthcare Center Specialty Clinic at 218-927-5566. It's also important to note that virtual visits are available, and we can do this using Zoom teleconferencing or even over the phone if necessary, if you have more questions. Speaking of questions, if you have any questions, now is the time to ask them. Thanks for your attention during this presentation.